back, everyone. February is National Heart Month, and while pregnancy helps the heart grow, it is important to ensure individuals are safe during their gestational months.
We are joined today with Dr. Jennifer Merriman, from Intermountain Health in this sponsored interview to educate views on heart health for pregnant individuals. Welcome.
Thank you.
This is something that's so important. I mean, heart health in general, but then as it pertains to pregnancy, tell us why this is so important.
Well, I think heart health in general in women seems to be overlooked. In fact, it is the most common cause of death in women, more so than breast cancer. And recently a study came out showing that women in general are more focused on their risk of developing breast cancer than their heart health. So it is definitely not as emphasized as it probably should be within the female population.
And so that's why we're talking about it, especially this month. So how can we set ourselves up for a successful pregnancy when it comes to heart health and making sure that we are good to go before pregnancy?
So a couple of ways. So one, you can try to modify the risk factors that you have control over. So living an active lifestyle, eating healthy, trying to take care of medical problems that put you at increased risk, such as hypertension or obesity, or high cholesterol or diabetes even. And then for women that do have chronic medical conditions, which is at least 40% of the reproductive age population, it's important for them, if they're considering a pregnancy, to seek care with either their primary health doctor, obstetrician, to try to optimize their health prior to a pregnancy, or for women who are early pregnant, seek prenatal care early to try to identify whatever risk factors we can help improve upon during pregnancy to minimize maternal and fetal risk.
If you are experiencing some symptoms and are even concerned just a little bit, I think sometimes we write it off as, well, maybe I won't check right now. What would you say to someone who might be concerned?
Definitely seek care, or at least ask somebody. And in women, it's particularly important because though crushing chest pain, for instance, is the leading symptom of a heart attack, that's not always the case in women. Sometimes the symptoms are vague: nausea, shortness of breath, fatigue, and can be easily attributable to something else or overlooked in that regard. So if there's something that just doesn't strike you as something is not quite right, I think it's important to at least ask.
And a lot of times we think this might just be pregnancy, right, Saray? When we're pregnant, you're thinking, oh, maybe this is just normal.
Yes.
But when it pertains to your heart, it's probably very, very important.
Oh, absolutely. Absolutely.
And I'm sure overlooked. When you talk about 40% of people don't know that they have a chronic issue during or before pregnancy, what can happen if we don't address some of these issues beforehand?
Well, it really varies issue to issue, but one of the key things is identifying what the issue is, making sure that women are hooked up with the right medical care for whatever it is. And oftentimes maternal fetal medicine is involved in trying to help coordinate pregnancy care along with an obstetrician, or sometimes in lieu of an obstetrician.
I love what I'm seeing right here. You're saying some lifestyle choices that you can make. Obviously, eat healthy, have a healthy diet, don't smoke or vape, make sure you're active, and sleep.
Yes.
Get that 8 hours of sleep
Absolutely.
at night. It's important.
It's a big life stressor. It really, really is, especially chronically.
And we talked about the differing symptoms, right, between men and women. It's really important to know those differences. And it's hard.
It is.
It's hard. But also, you need to talk to your family as well to find out if there is a family history with heart disease.
100%, because the ladies that have a family history have an increased risk on top of whatever's going on, or even independent of any health problems they have.
Would you almost say, if you do have a history, just ask, just be seen. If the percentages are that high, there's no harm in that, right?
Absolutely, absolutely, especially with a family doctor, which is probably a good thing to have a family doctor, an internal medicine doctor for all of us.
And I think the message too is there is hope once we identify some of the issues or chronic problems that moms may have, moms to be, that we can adjust and maintain and manage, right?
Absolutely. It doesn't, just because you have a chronic medical problem doesn't mean you can't carry a pregnancy and have a good and safe, healthy outcome. But it is important to make sure that we're appropriately identifying those women. And as such, there is a clinic called the Prepare Clinic, which is a new clinic through the Maternal Fetal Medicine Division at Intermountain Health. And Prepare stands for Pregnancy Prevention and Preparation to identify risk factors, essentially, in pregnancy, and help modify those risk factors and talk to women about the risks of pregnancy.
Dr. Merriman, thank you so much. If you would like to find out more about this new clinic, just head over to intermountainhealth.org. It's the Women and Heart Health Intermountain Heart Health and Vascular Program. Thank you so much, Dr. Merriman.
Thank you for
spreading
having me.
awareness. This is important.